Dr. Christy Osborne, and what we're going to be doing today are running through our neck exercises. They're really more stretches than anything, but it's helped to get increased mobility in our neck, increased range of motion, help stimulate the nervous system. And so we either have recommended these for you through our clinic, or if you found this video in search of this stuff, I would highly recommend making sure that you have a great upper cervical chiropractor that's helping manage the nervous system and helping making sure your structure is correct. My biggest thing with these things is nothing with these type of exercises, nothing should hurt. So with this, we've been working on the structure more than likely up to this point, and we're wanting to add on to start helping that soft tissue to help get us further towards our goals, or we need to work on the soft tissue at this point to get the structure doing even better. And in turn, our structure determines our function. So all of this is just about getting more functional so the body can function better. When our body functions, we're able to do the things that we want to do, and more importantly, the things we need to do. So with these, we're gonna start with active neck rotation. So what you're gonna do is just act like you're drawing a circle with your nose. And we're gonna do that 3 times one way, and then we're gonna switch. Sometimes people need to rest in between. If you're getting any sort of lightheadedness or dizziness, just rest in between. You can also slow those down. But I'm gonna run these through with you in hopes that you can follow along with this video. And the timing shouldn't take any more than 5 minutes to run through these. And we wanna do them at least once a day. So we already went to the left side there. So we're gonna go the opposite way now. Wonderful. The next one we're gonna do is we're gonna do a stretch. And what this is gonna be is a tension release stretch. And this is really gonna help with the trap muscles, the neck, the muscles in the front of our neck here. So we can help open that up, keep the head back, and keep this open here. And with this, again, we shouldn't have pain. If we're having any pain, numbness or tingling, make sure if you're a patient in the clinic that you talk with the doctors about it, because we may need to modify this. Or if you're not seeing anybody for your structural care, we'll definitely make sure that you start doing that. So what we're gonna do is actually just place our hand here on our head, keep the nose pointed forward for this one, and we're gonna hold this here, and we're gonna just hold it for 30 seconds. Awesome, and then we're gonna switch to the other side. Awesome. We're going to go back to the other side now. So back over here, but this time what we're going to do is tuck our chin down, tilt our head, and then we're going to kind of pull forward this way. So forward and down. And we're just putting enough tension on there to where we're seeing a good stretch in there with what's called your levator scapula. And we're going to hold this for 30 seconds here. And then we're going to do the other side again. So again, chin forward to the side. We're pulling this direction. Wonderful. And then moving on from there, we're gonna do shoulder squeezes. So, and these are great because you can do these at your desk. So one thing we can do is we can either do motion with these. So you're rotating here and you're squeezing at those scapulas in the back when you do this. Or you can keep your arms here and you're just trying to bring those elbows together in the back. Wonderful. We're going to do a couple more of these. Good. And then we're going to work on a little bit of shoulder mobility. So you should be able to do these at the desk. With this, we may have to turn or scoot our chair back. So I'm going to scoot back here a little ways. And what we're going to do is just our arms down by our side. We're going to bring that all the way up. Hold it for about 3 to 5 seconds. And then bring it back down. Do that the other side, all the way up here. And then bring that back down. All the way up. And again, hold that 3 to 5 seconds there. Good, and then we're gonna do that to the side. So pull that up and hold that right here. And you should feel a good stretch all through here. And you can hold these if you feel like you're not feeling that at that point. You know, hold them a little bit longer there, but it's really just increasing that mobility to get better motion in our shoulders. 70% of shoulder problems originate in the neck. So if we can keep our shoulders mobile and keep our neck mobile, then we should be able to keep our shoulders and arms working for us for a really long time. And then the other thing here is we're just going to go through some range of motion. So we're going to do where our head comes forward and we're going to hold that there. And then we're going to do extension. So where we look all the way up. Now we don't want to try to force it back. We're just going to work within our normal range of motion. So if your range of motion is right here, then we know we need to work on it. We need to improve it. And the way that we do that is by doing these range of motion exercises. So when we look all the way up here, and then come back to center slowly. And then we're going to do the same thing side to side. And what I want you paying attention to when you do these is when you start out with working on these exercises and really stretching and getting that range of motion back in, how does that feel? So check in with your body. How does that feel when you do that? And as you keep doing these and continue with these and continue with your structural care, that should get either easier to move. We should be able to get that further. Whatever, you know, we've got goals with all of our patients in here and everybody starts at a different starting point. So those goals for you may be just to be able to get our head where we can look up towards the ceiling. Where other people, it may be more functional things where, you know, we're either with weightlifting or sports or activities and that kind of stuff. But just make sure you're paying attention and check in with your body while you're doing these so that you can yourself be able to see that progress that you're having with it. So thank you so much for joining me today with these. Make sure, again, you're keeping up with these every single day or more often if that's what's been recommended for you. Again, I'm Dr. Christy Osborne with Scenic City Clinic. Thank you.